Oh, hello. Are you waiting for an appointment? Oh, right. Okay. Well, I'm a medical doctor. Oh no, he's retired. No, I'm his replacement. Yes. Didn't you know he was retiring? So your doctor has retired very suddenly? You should have gotten a letter about that. But I'm the new doctor. My name is Dr. David Alexander, and I'm a nervous doctor. Nerves, cranial nerves doctor man. I'm a medical doctor. Yes, I am, and I'm the new doctor, and I guess that you're my first patient. So, hello, nice to see you. Did you have a nice Christmas? A nice New Year? Yes? Good. Yeah, I did as well, thank you very much. I took a holiday to Israel. That was very nice. And the weather was a bit colder than I would have liked, but got some skiing done, so that was good. Okay, well, I tell you what, because obviously we haven't formally met yet, I'm just going to take personal information from you, so that the next time that we see each other, I will know everything about you, which of course is very important for your medical history, to have records of all of your information, so that the next time that you come in, if anything has changed for the better or worse, things can improve and get worse all the time. We never know. It's the sweet mystery of life, and that's one of the reasons I became a medical doctor. I love the mystery, life. Why does it keep happening? But yes, in the meantime, we can just do our best and explore together this fascinating and terrible thing. And right now, I'm going to test as the name of the examination suggests, it's the responses of various stimuli that you have, to make sure that all the nervous systems in your head box, the cranium, as we call it in the medical trade. What was I saying? It's not important. The important thing is that I am definitely a doctor. Right. So I'm just going to take some of your personal details down on this piece of paper here. So if you could just give me your name, please. Your first name, yes. Is that with 2 E's or 7? Right, okay. There we go. Oh, sorry, it's hyphenated. Right. Okay. How do you spell that last bit? Right, okay. There we are. And do you have a middle initial? And your surname, please. Oh, that's a bit... Can you spell... If you just spell it from the beginning, that would be very helpful. Oh, it's double-barreled, I see. How many? 2 T's, right. Okay, great. So that's your name. If I could get your date of birth, please. Ah. Well, you certainly look about that age, yes, definitely. And, right. And where were you born? Lovely. Very nice. And, just for our purposes of, if any additional treatment might be required that would be chargeable, can we take your if you give me first your national insurance number, please? Yes, no, it's quite important that I have this. Okay, yep. And your bank account number, please. And your sort code. As I say, it's for important reasons. Excellent, there we go. And could I have just on your credit card the last 3 numbers on the back of the... Okay, thank you very much. And just so that we can set up a private account for you, could I have a your eBay password, please? Right. That's not very secure, is it? Don't worry. Everything's safe with us. Okay. And right. I think that's all the information that we need right now. Goodness me. Right, okay. Well, if you bear with me just a moment, I'm going to transcribe this onto our... We've got this magnificent device. It's called a a computer, you see. So I'm just going to just get the rest of your information here. Okay, so I have all of your personal details right here, and I'm just going to, as I say, just type it up into our computer device. So if you bear with me a second, I'm just I'm not the world's fastest typist, but if you bear with me a moment or two, I'm just going to upload all of your information to our database. Yes, lovely. Are you thinking of going away anywhere this year? Maybe later in the summer? Well, just in case your medical bills are very high, I wouldn't necessarily be that ambitious. But, you know, good luck. Just have to wait for the computer to load. So slow, these things. We really should get rid of them. Much quicker to just write everything out and have it right there in some kind of filing cabinet, I think. But call me a Luddite, but you know, I don't think that the medical profession and computers should mix. I think that's a terrible, you know. Oh, this keyboard really is filthy. It's covered in crumbs. I think someone's been eating biscuits here, so if you bear with me a second, I'm just going to... People really are disgusting, aren't they? I mean, did your last doctor just eat biscuits all over his computer? Revolting. Okay. There we go. Right. So, just before I begin the examination... What this? Oh, that's just some tea. Before I begin the examination, I'm just going to put on my pink medical gloves. So if you bear with me a second. Just going to administer the gloves now. Well, that's one. 2. There we go. Good. So I'm just going to quickly listen to your head to make sure that you're all good to begin. And yep. Just say ah. Perfect. Okay. Yep, you are still alive, so that's a good starting point. Now, I'm going to begin today's examination with a very straightforward, very simple smell test. I'm going to hold some objects under your nose, and I just want you to, without looking at them, identify what they are. See if you can smell what they are, and just let me know if you have figured out what you think they are. Right? So it's very straightforward. It's a classic medical exam technique that I'm sure you've seen on television before, in Colombo or something like that. So, okay, I'm just going to hold something up to your nose, and I just want you to identify it by smell, if you can. So here we go, that should be under your nose now. Just take a nice big deep sniff through your nose, and just see if you can identify what that is. You're correct. Perfect, 100% of the marks. It's some old rotten milk. There you go. Absolutely disgusting, but correctly identified. Well done. Just gonna hold another object under your nose now, and just again, if you could just, that's it, big deep huffing sniff. Breathe it in. Breathe it in. There we go. And if you could just try and identify that for me. Yes, that's correct. It's an old shoe. Oh, it's a bit ripe, isn't it? But just goes to show that your olfactory sense is seemingly working at 100%. So I've just got a couple more objects for you to identify through the sense of smell, and I'm going to get the next one for you now. So I'm just holding that under your nose, and again, just a nice... Can you tell me what that is? Exactly correct. Again, it's a small porcelain doll's head and shoulders. A tiny bit of the torso there. You managed to identify that correctly, so fantastic. Just going to hold another object up to you, and if you can again attempt to identify this by smell, that would be... The reason that I'm giving you so many things to smell is that I like to be thorough. I'm a comprehensive medical professional, and the more tests that I do now, the better, really. And we've got all this stuff here in this medical practice. You know, lots of toys here, lots of doctors' toys, and why not put them to good use? So Again, if you can just... Yep, that's right, it's a wooden stick. Well done. Yep. I mean, I've never met anyone with such a good sense of smell. It's really very inspiring stuff. I've got one more object for you to sniff now. If you could just smell this, please. What do you think that is? Yes, it is a compact disc, a CD, but could you be more specific? Can you identify what CD it is? Perfect. Yes, exactly correct. It is the Jack and Sarah original soundtrack CD. So you've passed the smell test with flying colours. So that's good. Okay, right. Moving on to the second round of examinations, I'm going to test your eye response movement. So I'm going to do, very simply, I'm going to take this finger here, and I'm just going to ask you to follow it with your eyes, like that, you see? So just follow the finger. There we go. Very good. And up and down and all around like this. Very good. And way over there. And then way over there. Very nice. And then I'm just gonna finger towards you. Just follow the finger, keep following it. And now I'm just gonna... Can you see me doing this? Yep. See me doing this? There we go. Very nice, isn't it? Yeah. Perfect. Okay. Alright. I'm just gonna try that again with a different stimulus. So that was a finger, wasn't it? But now I'm going to try it with a bright light, just to check pupillary response. So here we go. Here's a bright light. Can you see it over here? And over here. There we go. Up here. And down here. Very nice. Under here. Oh, a bit spooky, isn't it? There we go. And just going to move it around. I just want you to follow. So, yeah. There we go. Perfect. I think that your eyesight is seemingly 100%. Again, that's how we measure eyesight in percentages. And yeah, your response seems to be, I mean, you know, I'm not an eye doctor. Well, in a general sense, in so much as it's part of the body. I'm a general body doctor, really, but cranial nerve, that's, you know, it's a new area for me, but it seems to be going fine so far. Right, we have some more tests to conduct. They are sound tests, so I'm just going to make some funny noises, and you tell me if you can hear them. Okay, I'm not going to I'm not going to tell you what the noises are first, so that hopefully they will take you completely by surprise, and then we'll just see how you react to those. Okay? Good. Right. Just going to whisper in your ear. I know that we have only known each other a short time, but I am completely in love with you. Did you hear that? Yes? Okay, no, it's just an exam. It's just a test. So I'm just going to whisper something in your other ear now. I mean, I really am in love with you. I know it's very bad for doctors to fall in love with their patients, but I can't help myself. You're the nicest person that I've ever met. There you go. Did you hear that? You did. It's just a test. Honestly, I'm a medical professional. I know exactly what I'm talking about. So just once more in this ear. Maybe after work you would like to go out with me and get something to eat or drink. Yep. What do you think about that? No, you're hearing. What I'm saying is just nonsense sounds. It's complete nonsense. Okay, and then one more in this ear. I'll pick you up around 8 o'clock, if that's okay. If that's all right with you. You're really the loveliest person that I've ever had the pleasure of giving a cranial nerve exam to. Again, just completely nonsense. It's not even English words that are coming out of my mouth. It was just some weird farmyard sounds or something like that. But you seem to be able to hear perfectly well, so that's good. We do have a secondary sound test that we can perform. I will need to get my tuning fork, so if you bear with me a second. Here it is. This is, as you can hear, it's my tuning fork. So I'm just going to make these sounds, and we're going to see how much your ear pupils dilate by, and this measures the response. But I'm sure yours will be, again, 100%. You seem to be completely acing this cranial nerve exam. So it is a tuning fork. It's a medical tuning fork. It's not like a musical tuning fork. This has multiple prongs for medical reasons, but it is I mean, your hearing is fantastic. I'm very happy that you're my first patient for this exam. It couldn't have gone better, frankly. You know, I'm happy, and I hope that you're very happy also. So, okay. Okay, this concludes the exam. Luckily, as I say, you are, seemingly extremely responsive, and this is a good thing medically. If you weren't, you'd be dead or dying, which obviously, that's good for the funeral business, but not so good for the medical business. And I'm in the medical business, so this is a boon for me, and you get something out of it too, which is a functioning head, which is nice. Well, thank you very much for coming in, and I think that if you just speak to my receptionist, we will have you back in quite soon, I hope, for a follow-up examination, and we will test other audiovisual stimuli, but I'm sure that you will pass that again with flying colours. Or not. People can change and deteriorate or improve. I don't know how well one could improve past 100%, given that one can only have 100% of anything. But maybe next time it will be 110%. Who's to say? I don't know. What am I, a doctor? I mean, I am, obviously, but not a maths doctor. That's a different type of doctor. I'm rambling now, sorry about that. Yes, you must come in again very, very soon. Very soon, if that's good. Well, thank you very much, and see you next time.